Welcome back to part two of the Voices of Healthcare Equity and our guest, Dr. Neka Una Chukwu. Dr. Una and I have had an amazing first half conversation talking about her journey to becoming a pediatrician, spending much of her young adulthood and childhood in Nigeria, and then coming to the U.S. again, where she was born, starting her own practice very soon after medical school, and doing that in a very casual and humble way, but with amazing courage and tolerance for risk. And then deciding and seeing very early on, having that discernment that something in healthcare was changing and would require yet another change, not just from her, but from the healthcare community in the future. And talking about physician ownership and physician empowerment and physician entrepreneurship as the solution, the Calvary to the dark times that medicine finds itself in 2024. Welcome back, Dr. Una.
Well, thank you. We've been having a great conversation. I feel like I can talk to you forever.
I feel the same. This is much needed and wonderful conversation. Dr. Una, you talked about 100,000 physicians taking ownership, becoming empowered, being the CEO of their part of the big global solution and the amazing global impact that we can have. The current physician workforce is 13 million physicians globally. And like you, I like to look at the big picture, the goal, because that's where you need to know your destination in order to get there. And for me, at least the first stop on my destination, I have the little g and the big G goals, would be that 1% impact. We are looking to get 1% of those 13 million physicians. That's 130,000, entirely close to Dr. Una's goal of 130,000 physicians. To get 130,000 physicians to, for 2 hours of a whole year, spend time on a telehealth interaction with a patient in a low middle income country where more than 80% of the world's population lives and carries the greatest burden of poverty and the greatest burden of low healthcare worker to patient ratios. So, very little healthcare for the majority of the world. 2 hours of a year. And if 1% of all those physicians did that, just 1%, it's such a small number. Like if you had a 1% interest rate, you'd borrow $1 million. We would have 700 hours every day of additional physician coverage, 1,600 hours every day of nursing and midwife coverage, 100 hours every day of dentists. Think of those people, children, adults, all over the world that cannot get healthcare. It's not an option. People don't have options, and we can change the world. When you change healthcare for people that don't have options, you create the future. You create people that feel valued. You create people that understand that they are important in their community and in the community at large. You create the right foundation for what we're always saying we want, which is equity and peace. You cannot have those things when some people are treated differently than others and get that message at the most important parts of their life. The most vulnerable is when you are in need of health and life-saving intervention and you don't get any. That scar, that damage is carried for your whole life. Dr. Una, you are shaking your head. I am dying to hear what you would have to say about that.
Man, I have so many thoughts. And the first thought here is first of all, this is a power of sitting and articulating what you want to do, going to the end of the goal, reverse engineering it, right? Because when you look at the impact of just getting doctors to say, oh, I'll do 2 hours a year, and that translates to 700 hours a day, that is like mind blowing because 700 hours a day, like think about 700 hours a day and touching 3 people per hour. Like the math is insane, right? And so it's a goal, it's a big goal, but you've broken it down so it's clearly doable, right? Now all we have to do is get the manpower to pull it off. So first thing I want to say is to the person who is listening to this podcast episode, I want you to think about sharing this podcast episode with people who talk to a lot of physicians. These could be hospital groups, this could be associations, this could be your physician groups on Facebook and LinkedIn and all of that. This could be like your alumni. All of the like these are people you have access to. I want you to think about the power that you have that by saying, you know what, I'm going to make a list of 12 of these places. I'm going to take this link, I'm going to share, I'm going to say, oh my goodness, skip all the way to XYZ, this part over here. And I want us to do that. Like on your own, if you get 10 people to say yes, you would be responsible for 20 of those hours, right? Like they're doing 2 hours, they have 20. You get 20 people to say that yes, you're responsible for 40 of those hours. And literally what that means is, Dr. Kim, if we have 20, 30, 40 people who decide to take up this challenge, you are so close to your goal. You know what I mean? Because it's doable, and that's what I'm trying to say. The healthcare space needs the cavalry to rise. When one Dr. Kim stands up and says, this is what I'm going to do, and 20 other people saying, we're going to support what you want to do because this will take nothing from anybody to do this, right? Like they will take nothing. Once you have that number of people, then you've started creating this tsunami of change. And those people talk to people who talk to people who talk to other people. And then that's how then Dr. Kim, you're like, wait, I thought it was 130, but Dr. Una, I did the numbers. We're at 260. And I'm like, sounds like a good problem to me, you know? And so that's really powerful. But that's the power of one person saying yes. That's the power of us rallying around one person who says yes, because then Dr. Kim will turn around and rally around whatever your thing is. You know what I mean? And this is one Dr. Kim. And so we have 100 Dr. Kims. Think about the ripple effect of that. We're the people for the job. We just need to recognize that we have the power. It is within our power to fix what is going on. And we are going to need to retool ourselves. So, Dr. Kim, I don't know if they taught you how to do a podcast, when you're doing your emergency medicine residency. I don't know if they're like, this is your class on podcasting, right? I don't know that anybody taught you that. I know, but I don't know if anybody taught you, well, this is how you lead a team that is going to accomplish a mission. I don't know if anybody taught you, like, this is how to speak on stage to rally people around for your cause. I don't know if people taught you to reach out to referral sources and all. These are all things that you're doing to pull this off, but you decide to retool yourself. And now something you can think in terms of global problem and I will fix that. Like the mere fact that you're like, that's what I'm going to do is so mind blowing, but it requires retooling. And so you're listening to this. I was going to write the EntreMD method. You talked about it earlier. That was the first EntreMD book that I wrote. Um, I was going to, I was going to call that book Adapt or Die, right? Like, so this is 2016, right? When I first started thinking about it, where I was like, doctors need to understand what is coming. And I was like, that is so morbid. Like, but really the concept is the old version of MD, where I do pre-med, med school, residency, fellowship, and just work my job till I die. I do what I'm told and stay in my lane. That paradigm is gone. It doesn't work anymore. It's not secure. It's not safe. It doesn't give a huge impact. The dreams you have will most likely die with you because that is not a paradigm that allows us to accomplish our dreams. Okay, so Dr. Kim, yes, she's an emergency medicine doc, but her dream is to bring about global change. That does not work in the container of the old paradigm. The new paradigm is I do my pre med, I do my medical school, I do my residency, I do my fellowship. If I do that, and then I acquire business skills that then give me the freedom to actualize my dream, whatever that is. So she's talking about global impact. That's not a thing I wake up thinking about, like not global, like global healthcare and equity and all. That's not a thing I wake up thinking about because that's her dream. I wake up thinking about, wow, if we can get these doctors to understand how to monetize their businesses, whatever that is, whether it's their personal brand because they love their job and they want to stay there, they never want to leave, whether it's a private practice, whether it's a direct primary care practice, whether it's coaching, consulting, speaking, hosting events, whatever. If I can show them how to monetize that so they have the freedom to do it and have a huge impact and create financial freedom, we're good. I wake up thinking about that, right? Because that's my thing. So it is the new paradigm where we acquire these skills, where we retool ourselves. This is where we get the freedom to do what we've always wanted to do. That's where that happens. And so my challenge for everyone is one, to support Dr. Kim, because again, and she'll tell us how to do this, but it can start from this podcast episode like here, just share it with two docs and say, hey, will you give us 2 hours a year? Right? So you can share with all these associations and stuff. The second thing is for you to, the second challenge is for you to make a commitment to retool yourself, to understand that the healthcare space needs a Calvary, it needs saviors, it needs people who would fix it. You're the person for the job, but you 1.0 cannot fix it. You 2.0 can. So the time to retool now is now. The time for you to say, yes, I'm the expert, I'm the person for the job is now. The time for you to no longer say, I'm shy, I don't speak is now. The time for you to say, I'm shy and I'm introverted, but I will be a boss at networking is now. The time to show up and sell your vision and say, guys, this is what we can accomplish together and get people to rally around you, that time is now. But we cannot be the, oh, we stay in our lane, we do what we're told, and I'm just a doctor, you're not just anything. There's nothing just, first of all, about being a doctor, okay? But we've learned how to replace hearts, replace knees, intubate, preemies who are less than a pound. We can figure this out, and we can be the answer that healthcare needs. There's nobody coming. We're it. If we say no, if we don't say yes to the call, things are going to be bad for a lot of people. And those people are counting on us to say, okay, I'm going to put my fears aside. I'm going to put, my perfectionism aside. I'm going to put, my, because sometimes it's just like, oh my goodness, you mean I have to learn new stuff? Yeah, you need to learn new stuff. Like, I'm going to put that aside. I'm going to learn the new things. I'm going to retool myself. There are 330 million people in the United States. Dr. Kim will tell us how many in the world, okay? But in the United States. And we have a failing healthcare system. And without health, it doesn't matter how much money you make. It doesn't matter how much you love your family. It doesn't, like, those things don't matter because if the health is not there, nothing else matters. And so, if we can retool ourselves, Dr. Kim, I'll probably give a few examples. These are doctors like a Dr. Rachel Rubin is the one who says, you know what? Nobody's talking about women in menopause and they're suffering, all these things are happening. I'm going to fix that. She's one person, shouting from the rooftops and doing what she does, right? That people who come up and say doctors are dealing with, burnout and they're going home and charting at night and all, that's my hill to die on, like a Dr. Mary Luang. And she's just like, I can fix this. You don't ever have to take work home. And these are just examples of people who are taking things and saying, I'm here for it. We need to do that too. Everybody needs to do that. The healthcare system is dependent on us. I went on a whole rant, but
Woo! I mean, wish I had sound effects. We need a big crowd cheering and wooing for that, all of that. So, audience, if you are trained in medicine, You have a skill that cannot be replaced easily. I am a doctor. I have done this work for 20 something years, and it is so seamless and easy for me to do this work, but it's life changing. I stand at the bedside of people who are dying, and I do things to give them that 1%, 2%, 3% chance of survival, and they live. And I do that on a regular basis. Y'all, we know how to do hard things, and we know how to do things that nobody else can do. I can learn business, I can learn marketing, but business people and marketers can't learn what I know. Just last night, this is nuts. I was on telehealth for 3 hours taking care of people in the Philippines. And I'm the CEO of the company that does that. How many CEOs are on doing the patient care, understanding what needs to happen, what could go wrong, what could go better themselves? That is real understanding that makes me an expert in global health. That is rare. You're not going to find somebody that's doing the work and running the company at the same time. And that can be you, that can be all of us. We need to keep solution focused. Dr. Una talks about this all the time, these big dreams, these big solutions. I think sometimes we are in a dark period, and it's easy to focus on our problems and talk about our problems, but we have to talk about what's going to be next. Yeah, sure, let's talk about the problems. You need that a little bit of motivation. I take my anger and use it as fuel. So let's use that as fuel and motivation, but keep focused on the solutions for the next step. And Dr. Una is always, always uplifting others, and through all of that in there. We are in the midst of crowdfunding right now, so please go to https://haew to volunteer, to learn more about us, or to support us. All of those things matter and help us. I want to ask Dr. Una, I always like to end with a big picture, inspirational message. If you could ask for anything, what would you ask for to help you achieve your highest ideals?
If I could only ask for one thing, I would ask for each one to reach one. For instance, I'll give you an example with your business. Big goals are not big if we can activate the grassroots. And so, if one person listening to this podcast would share this with another doc and say, go sign out at haew.org, and that person will tell somebody else, who tells somebody else, who tells somebody else, your mission will be a wrap. And in my mission, it's really about empowering physicians so that they can take these missions, build a system around them, because it doesn't work without the system. People die with their dreams every day. But if you build a system around it that allows you to serve a lot of people and create financial freedom at the same time, then we can unleash so many physicians. And so if the person listening to me right now will say, you know what, I'm going to share this with somebody else, and I'm going to tell them to share it with somebody else, and I'm going to tell them to share it with somebody else. You're on Facebook, you see in Facebook groups how much despair and pain and hurt physicians are feeling. They have no idea there's an answer. They have no idea there's a way out. They have no idea. And if everyone will tell somebody else, you go listen to Dr. Kim's podcast, go listen to the EntreMD podcast. If you would be the force of light, then we can get rid of the darkness in the healthcare space. We can get rid of the darkness in the physician community. It's a lot. And I don't know every physician, and never going to know every physician. But if everyone could be responsible for the physicians in their world, we can change things and change it fast.
Thank you, Dr. Una. And the community that the EntreMD Business School has built is a most amazing community. I personally did not think very much about what direct primary care is when I first entered that community. And now, if I need a physician, I'm definitely going to look for a DPC or a private practice physician because I'm around these people and I understand their passion and their commitment and how they feel about their work and how that translates to how they treat their patients. And that's the kind of care you want to have when you need something, whether it's infertility and you really need to have a child, whether it is sexual dysfunction. I mean, all the things. There are doctors in this EntreMD community, and soon doctors all across the United States who are working in this community to make that dream a reality. And that's really uplifting for the patients that they serve as well. And for a community that is coming out of a pandemic um, in the shroud of darkness, but is that bright light and what's on the other side of that threshold. It's everything you want, but you have to dream it, you have to visualize it, and you have to make it happen. Um, Others will not make your dream come true, they will make their dream come true. And they will use you to have their dream come true. So please dream your dreams and get the support you need. Ask where you can find the support. And Dr. Una has definitely created the community for that support. I'm glad I took a chance and found it. I think when your eyes are open and you have a drive, you tend to find the things that you need. And there they come to you. So, Dr. Una, thank you. EntreMD Business School, the EntreMD Business Podcast. Dr. Una puts all the things right there on the podcast for you to go listen and learn. You can do that for free. Um, and so that's a good way to see what's available and what could be available to you. How can our audience connect with you, Dr. Una?
Yeah, so two big ways. The first is you're already on a podcast platform, so you just want to hit the search bar EntreMD, which is ENTREMD, so Entrepreneurial MD. And you can subscribe there. We show up every week, and like Dr. Kim alluded to, unbelievable value. Like people have reached out and said, I'm so grateful for this podcast, but I do not understand why you would do all of this for free. And the reason it's, like it's, you can see why. Why is because I'm trying to change the narrative for a million physicians, and some will work with me directly and some won't. And I still want people to experience the change that they need to experience. Now, if you're like, yeah, but I'm like Dr. Kim, I want to go all in. I want to, be in a place where I can get mentorship from Dr. Un on a weekly basis. I want to be in a place where I can be in a community of physicians just like Dr. Kim who are crushing it, right? Like who are getting the thing done and be with physicians in different types of businesses and all of that. It's a true mastermind. And you're like, and I started off like Dr. Kim and I kind of slacked off and all. I need the accountability. If that's what you want, then there is a place for you. It's called the EntreMD Business School. And what we do is we have you actually get on a call with our team. Is entremd.com/call. And we don't do any hardcore sales, squeeze your arm type of tactics. What we do is we help you see if this makes sense for you, if this is your absolute best next step. And if it is, then we invite you to join the school, right? Again, you'll be with doctors like Dr. Kim. And so that where to go to do that is entremd.com/call.
And it is worth it. And they have many ways of you paying for that. Just remember, everything is an investment in your dream. It takes investment. It takes investment of time. Your time is your biggest. moneymaker. And your investments in yourself. I made the biggest investments in myself at the age of 17 when I decided, as a first generation immigrant to this country, a child of a family that never went to college, living in the Bronx, that I was indeed going to become a doctor. I didn't know how. Nobody had done it before, but I knew it required me to go to school, and I was going to do it no matter what. And I borrowed sums of money that were unfathomable to anyone in my family. It was money that no one would ever make in a lifetime, likely, in my family. But I believed in me. That's inside of all of us. How does a 17-year-old Kim Tranquata know that she can do it? That no matter how much it costs, she was going to do it and pay for it and then thrive. If I can do that, I can do anything. And I have 20 plus more years of experience behind me now. And so do you all. So please always remember, invest in yourself and in your future, because that's worth more than the safety that you might be feeling today while you're a little bit unhappy and uncomfortable. Okay, with that, thank you everyone for joining us in this amazing podcast with Dr. Una. I'm sorry, Dr. Una inspires me to just think bigger and bigger and bigger. If we continued this conversation, we would probably be solving more world problems. But why not? It starts with one person. Today, in our podcast, we talked about healthcare empowerment, physician and other healthcare worker empowerment, and entrepreneurship as the way forward to fix many of the issues for our patients, for society, and our communities in healthcare. In our podcast, a common theme and insight is the vital role that collaboration between public and private enterprises and government support for sustainable healthcare equity innovation. So I ask, if you're a minister of health, a public health officer, or a dedicated public official working to enhance healthcare access and equity, please, we want your voice on our show. Join us, share your valuable insights and perspectives with this audience. Contact me at Dr. T, Dr. T at haew.org to secure your spot on the podcast. Listeners, please, we need your support too. You are the community, you are the Calvary. This is how we create the change. Share today's episode with a friend. Leave us a review. Interested in being a guest? Please email. Visit https://haew.org. Right there on our website, you can join us. Remember, 2 hours, 700 hours a day of physicians for world healthcare equity. Partner with us or contribute. Please, let's amplify the conversation for a healthier and more equitable world.